Hi, it's Phil the Engineer back again. I'm new at this video blogging thing and packed too many points in my first blog. I went over my time limit and was rejected. There are two more key points that we need to consider for healthcare for reform. The first is that health insurance providers must keep their books balanced. The second is that tax write-offs are typically not included when assessing the rising cost of healthcare. If they increase premiums too quickly, they run the risk of being dropped by the employer. Once again, those covered by a corporate healthcare system over the last few years are familiar with the ebb and flow of offered health insurance providers. Litigation is also a worry on their list, adding another detriment to managing our money. I don't really envy the health insurance providers, so they're in a very volatile and high-risk business. To illustrate this point, I'll relate my personal experience. First of all, I'd like to make it clear that I've been very fortunate. I had excellent health care plans through my employer for over 29 years. I had a very good long-term disability plan paid by me through my employer. This plan allows me to continue to work a couple of hours per week when I can. Yes, they do subtract 50 cents from my long-term disability benefit for every dollar that I earn, but I consider it a treatment for mental health and gladly reimburse them. Let's get back to my example. My first surprise came when I began planning for my last day of work. At the time, I had 2 children in college and a spouse without health insurance through work. We were all covered under my plan. I assumed that since I was of retirement age that I would be eligible for retiree health benefits. After weeks of inquiries, I was informed that a separation via long-term disability is a termination, and I was not eligible for retiree health benefits. In addition, when I did retire, these benefits were not an entitlement and could be withdrawn at any time. Luckily, my wife was able to find a new job with benefits to cover our family. But in the process for a job search, we discovered a subtle form of age discrimination. Due to the points that I stated earlier about the increased risk of payouts to a more elderly workforce, large and small companies were inclined not to hire older workers due to increased health care costs for these workers. Cigna had been our health care insurer a year before my termination. We were happy to see Cigna appear as an option of my wife's employer. The following year, I elected to have deep brain stimulation surgery. Cigna picked up the tab with no hassles. Of course, they had just settled a denial of service lawsuit. The next year, my wife's employer dropped Cigna as an option. Cigna had lost at the game of musical chairs. This brings us full circle to the issue of universal health care and how do we pay for it. I will share my ideas in a future blog. I've shared my perspective and experience on factors driving our health care costs. Hopefully this will inspire creative ideas on how to fix this problem. We are only one progressive illness diagnosis away from losing our health care insurance, as was seen with my experience. The sentiment has also been expressed by many of the other blogs. As a closing thought, we should be aware of the indirect costs of healthcare cost escalation. Many physicians and hospitals, squeezed by lower reimbursements, have increased their rates and take the delta between reimbursement and published fees as a tax write-off. This is a hidden contributor to escalating healthcare costs. Loss of tax revenue must be made up somewhere, so once again, it is our money. I'd like to thank you again for taking the time to view this video. Have a great weekend.